The CDC has released new guidance for people who have been fully vaccinated against the coronavirus. The agency says people who have gotten their shots can visit with other fully vaccinated people without distancing or wearing masks. They can also be in the same room with unvaccinated people who are at low risk of getting severe cases of COVID-19. Fully vaccinated people do not have to quarantine if exposed to someone who has tested positive for the virus unless they are symptomatic. The CDC says it's important for vaccinated people to still wear masks and practice social distancing in public. Meanwhile, vaccination rates in the United States are truly ramping up. A record number of vaccine doses were administered across the nation over the weekend. The CDC says more than 5.3 million people got shots in just 2 days. Nearly 60 million people have received at least one dose of a coronavirus vaccine. More than 30 million people are now fully vaccinated. For more on the current state of the pandemic, I want to bring in Dr. Ogechika Alozie. He is an infectious diseases specialist in El Paso, Texas, and member of the Texas Medical Association COVID-19 Task Force. Dr. Alozie, welcome. Great to have you with us. What does this new CDC guidance for fully vaccinated people tell you about how quickly and easily life may be able to return to normal in the United States?
Yeah, I think it's exciting, right? The CDC has come out with these guidelines that a lot of people were waiting for. I think that this is really just version 1. These guidelines will change over time. And so there'll be people on both sides who feel either they're not strong enough or they're too weak. But I think they have to remember that the science is evolving. But what we do know and what really seems to be clear is that there's enough data that the vaccines are preventing transmission. And so we're going to see the CDC pivot to that over time.
So much of the new recommendations will come as a relief to vaccinated Americans, but the CDC does say they will still need to get tested if they experience coronavirus symptoms. So what does this say about the vaccines and how safe people really are from the different coronavirus variants once vaccinated?
Yeah, and so this is where that sort of version 1 conversation comes into play, right? I think saying that the vaccines work, but at the same time, if you get sick, get tested, has a little bit of a mixed message there. I think it's fair if people do get vaccinated and they feel sick, they should talk to their physician or their provider and figure out what's driving it. And it may be COVID. I'm really bullish on the ability of these vaccines to prevent us from what we care about most, which is hospitalizations and death. If COVID just caused weakness, body aches, and a fever, we wouldn't have been in the mess we were in 2020. And so I think it's important that we really sort of focus on the hesitancy and what we need to get those immunity rates up around 60, 70, 80%. Let's talk about vaccine hope.
That is such good news and so good to hear. But Doctor, what I'm still not hearing a lot about, and I'm wondering what the science and the research is telling us, because I know we're sort of learning as we go when it comes to coronavirus, is how long the protection from these vaccines lasts.
Yeah, so I think the sort of common sort of layperson thing you'll hear out there is the 90 days. And I understand why it's out there, but if you really look at some of the things that have come out of nature and a host of research labs that are really studying this in people, we have every expectation that this will last a long time because it's not just the antibodies. We've got to talk about the T cells and the natural killer cells. And we have other examples and other viruses of it lasting years. Remember, the 1918 pandemic, there are people that still had T natural killer cells that were triggered by that virus. And so we may need to pivot to the variants, but I think, again, we've done a poor job globally focusing so much on the variants that we've scared people to death. And variant schmariants, and stealing a term from Dr. Monica Gandhi, we need to focus on the hope and the amazing success of these vaccines. And also remember, the B117, which is the predominant UK virus variant that we think is coming into the United States, there's no evidence that there's escape in it. And even then, especially in the Johnson & Johnson trial, there were no hospitalizations and deaths. And so, again, we got to figure out a way to get these positive messages to people, because that's the only way we're going to come through the vaccine hesitance. We're not going to fix it by scaring people to death about every variant. Sorry.
No, I agree, but I'm wondering, are you predicting that we're going to have an annual vaccination effort? I mean, does it seem right now that these vaccines will be like the flu shot?
Yeah. So I specifically stay away from trying to be Nostradamus. I don't think we're going to get there. I don't think we're going to be yearly. And again, this will probably be pulled up a year from now to prove me wrong. But I think the science and the data shows that we are on a good track, that even if we do require a booster, it won't be a yearly booster. But again, I think it's too early to be determined.
Yeah, well, that is very, very good news. Dr. Alozie, you are joining us from Texas, which is fully reopening with no mask mandate, as are several other states. How concerned are you about spiking cases in the state, even as vaccinations ramp up?
Yeah, I think that as a member of the Texas Medical Association COVID-19 Task Force, we've been really focused on reminding people that it's a personal responsibility. We're not out of this yet. And like you said, we're ramping up vaccinations, but maybe 10 to 15% of our population has been vaccinated. Until we get to a point where a larger proportion of people are vaccinated, it makes every bit of sense. People need to be careful. And so if you're in a vaccinated household, absolutely, unmask, enjoy the fact that you're vaccinated, but it would be sort of irresponsible and unfair for you to take that into the community when 60 to 70% of the people that want to get vaccinated haven't. And so our vaccines are the key to getting through all of this. That's how businesses get open. That's how travel gets returned. That's how families get to engage. And so being outside is key. Texas is a great state in terms of weather. And then wear a mask where you can and take that personal responsibility to reduce your risk.
Oh boy, it sounds like good times are ahead. I can't wait to get my vaccine. All right, well, Dr. Ogechika Alozie, thank you so much for joining us. We appreciate it.
I appreciate you. Thank you so much.